I've always understood how very lucky I am to have survived this, and over the years, the kind of reactions I get from people is basically astonishment and surprise, and they kind of always made me feel like I was the only one. But I was very happy to find that it's not all about me. And not only are there other survivors, we just met a bunch of them last night at the gala, but I was delighted to find a very similar story to mine unfolding at the exact same time as my case to somebody who is separated from me by actually less than 6 degrees. Of course, I had heard of Dr. Michael Clarfield. He is one of our leading sports medicine specialists. He's been the physician to the Leafs, to the Argos, to Tennis Canada, and to the National Ballet, and to a lot of my friends. I know his sister, Carol. I play tennis with her. And so I was very surprised to find out that he was diagnosed right at just about the exact same time as I was, and his outcome is equally positive. Dr. Michael Clarfield.
Thank you, Libby. It's nice to have both of us here. I first want to thank the Pro family. Putting on this great event today. Is an outstanding event and the first in Canada, and so important for all of you here to attend and to raise awareness and to hear what's happening today in pancreatic cancer and what the future upholds for people like us and people that we are touched by, and people that will be futurely touched by this. And today is about hope, and not artificial hope, but potential hope, because as we've heard today, generally the statistics are not that great. And when Sandy asked me to speak today, I found myself wondering, what would you people who have all been affected by or touched by people with pancreatic cancer, what you would want to hear? And as a 5-year survivor, like Libby, we're constantly asked to speak to people who have been affected by cancer and by this terrible disease. And have been through, not only myself, and what Libby didn't say is my mother, who passed away from pancreatic cancer as well, and my own personal experience, I have certainly a lot in common with all of you. And hopefully, hearing my story will help, because every situation is different and unique. But maybe it's something I will say will resonate with you. And we'll go on from there. And because I'm a physician and a survivor, as I mentioned, I'm asked to speak about people like you. And so here's my story. My story actually goes back, I can't recall exactly, maybe 15 years ago, when my mother was diagnosed with a precancerous pancreatic lesion. And that was when I first met Malcolm Moore at that time at PMH. And she had this precancerous lesion, and they said to her, well, this may turn into pancreatic cancer, or it may not. And so after regular visits, and unfortunately, she was unlucky, and her precancerous lesion turned into cancer. And when it did, at that point, it was surgically not applicable to have surgery in that time. And so she did have some chemotherapy at that time, and I can't recall the exact, well, this is going back 12 years ago, and I can't recall the exact sequence, but it was over probably a course of a year and a half, where my family and I watched my mother deteriorate with this terrible disease, and most of us have seen this happen to people we have known and loved. And it's not pleasant to watch, and my mother passed away 2 days prior to her 80th birthday. And it was not pleasant. So my wife, my young children at that time, who were, infants and maybe 6 and 8 at the time, watched her go through this, and they really saw what happens to people with pancreatic cancer at that time. And now I go into my story. So several years later, when I was 53 years old, And like any typical physician in the world, I've not seen a doctor for probably 35 years. And was obviously a very healthy and fit. I mean, I lived a great life, fit an individual, and really I think I'd missed one day of work in the 35 years, and that was got some gastro for my kids, and my wife said it was kind of funny. I got up in the morning and I was in the washroom and quite sick, and I said, okay, phone the office, tell them I'll be there in an hour. So I went back to bed, and then I woke up and then back in the washroom and said, okay, tell them it'll be another hour. But that was the only day of work I missed in 35 years before I was diagnosed with pancreatic cancer. And I had sort of had this sort of vague pain in my back for about 7 months' time. I said, I better find a family doctor, maybe get a colonoscopy, something's going on, which I didn't really do. And then one night, I had sort of about 3 or 4 hours of pretty intense abdominal pain one night. And I woke up next morning and felt great, went to work. And as Libby said, I run a sports medicine clinic. And in the clinic, we have radiological facilities, including ultrasound, which we do for we use ultrasound for sports medicine doctors, like a stethoscope for a cardiologist. And so we use ultrasound to diagnose a lot of musculoskeletal injuries. And I said to my other doctor, told him the story, he says, why don't you just go across the hall and get an ultrasound? I said, yeah, I should do that. So about mid-morning, I had sort of a 30-second break, went across the hall, and I said, you better give me an ultrasound. And so the technician there is doing the ultrasound, and she says, you have this large tumor in your pancreas, don't you? And I go, no. And I didn't talk about this in a while. Sort of bring back some memories. And so I went back to my office and sat down and phoned my wife and said, I don't think I'm going to be around too long. And being a physician, I was sort of, and we talked before about access to imaging. I obviously had access to imaging, so next morning at night I phoned my radiologist, and next morning I had a CT scan and MRI that day. And they said I had a very large 10-centimeter tumor in my pancreas. So it was bad news was that was a big, large tumor. The good news was that it was sort of a funky tumor that the surgeons initially looked at and said, geez, I don't think I've seen anything like that before. But the other good news was that they said, you got to get it out surgically, and you are a surgical candidate because there was no metastases they could see. It was not in the portal vein. It was localized to the pancreas, but very large. So within, I guess I was diagnosed in November, and 3 weeks later I was on the operating table and had, at that time, they weren't really sure what they could do, if they could do a Whipple and save some of my pancreas, or they have to take all my pancreas out. Unfortunately, the bad news was they had to take all my pancreas out, so I had a total pancreatectomy. But the good news was they got all the tumor out. And I had no metastases, and all the lymph nodes were clean. Now, while living without a pancreas is not the ideal scenario, and frankly, a pain in the butt, and the pancreas, but I'll tell you, it sure beats the alternative. So I got home after surgery, and I say it was the first day I'd been off work in my life, so it was sort of hard being home for a few weeks. And I went back in, and then I underwent 9 months of chemotherapy, gemcitabine and PFU, and 8 weeks in the middle of every day of radiation. And going through that, I can tell you, for me, was worse than going through the surgery. I recovered from the surgery very quickly, but going through all that chemo and radiation really ravaged my body, and that wasn't much fun. But the key thing, for me, was I'm always a very positive guy, and talk about alternatives and do alternative medicine, and for me, just the positive thinking of going through all that chemo and radiation, and every day I sat there and that radiation therapy and then that chemo, and I said to myself, okay, and I can visualize that chemo and that chemotherapy and knocking out every bit of potential little cancer cell out of my body. And I sat there, and I was at that time I was a leaf doctor, and so I had 28 radiation treatments. So every day I'd sit there and I go, okay. I sit in that tunnel, that radiation treatment and chemo, and I say, okay, who was 28 for the Leafs? And all the guys that were 28 for the Leafs, I named those guys off. And the next is 27, like Frank Mogwood, yeah, Frank Mogwood. So I go through all that stuff, and the last day, my buddies who knew I was going through this, they said, "Oh, I come with you," and they bought me a sweater, and they bought me Johnny Bauer's sweater. And Johnny is a friend of mine, and so I phoned John. I said, "Johnny, was the story." So I landed there, laid in that last two with Johnny Bauer's sweater on, and got my last treatment. But I got through that, and I'm a big exercise guy, and exercise was really important in positive thinking, and it was, I got through that, and here I am today. But then you finish that chemotherapy, and then I've talked this, and then you sit there, and we all still know, even you have surgery for your pancreas, and only 20% of people that have pancreatic cancer are amenable to surgery, and then people have surgery, only 20% of those live 2 years. That means only 5% of people, even with surgery, live 2 years. And then you go through this scan-to-scan thing, and you get a scan every 3 months, and you panic and anxious. You go through a time, you have a scan, and you say, okay, for a week you feel okay. It's pretty good now. The scan's clean. Then the next 2.5 months or 3 months, you go through this anxiety, waiting for the next scan to make sure this cancer has not come back, and knowing all the bad news that entails. And then and doctors aren't perfect, and you go through some bad experiences, and you go through this up and down thing. And my first time when I was in the hospital, I had a resident oncologist who says, okay, your tumor is 10 centimeters, you're grade 2 plus 2.5 or tumor, even though I had no metastases, and says, you're not going to live. So you get that kind of news. And then I was getting radiation, and the radiation therapist, the physician, calls me over and says, look at your CT scan of your lung here. You have all these metastases in your lungs. So, of course, you get in the car and you start crying again. You phone your wife and say, this is it. But he was wrong. They were just old scars from something. But again, you're going scan to scan of those. Are they metastases? Are they just fibrous scars from some kind of infection I had when I was 10 years old? I was never sick. I never had any lung problems. But so you go through this scan to scan, and you live this life, and until you're going through that, and your family's going through that, and you guys have all been through that with your loved ones. You go through that, and it's very difficult to go through. And as time passes, you feel better about things, and you get less anxious. You get anxious about that. And so what do I worry about now? 5 years later, it'll be 5 years in a month of cancer. And so we know that when you get to 5 years' time, I've met some other people today, and as Libby says, you don't meet too many pancreatic survivors. It's great meeting some survivors here. I've met some survivors here, and I've known Libby, and it's great to meet people that are in a similar boat. We're few and far between, so it's great to see them, and it does happen. There is hope there, and we see this stuff happening. There's hope that there's going to be in the future. But even to this day, and I'm sure and you guys are all the same, not a day goes by where you don't think about what you've been through and the potential of it coming back, and you live every day, and there's no doubt I live every day different than when I lived 5 years ago, and I relish every day. But what do I worry about? I worry about my kids. My kids now are 19 and 17. My mother had pancreatic cancer. She had lung cancer that she survived by a fluke at age 40. I had pancreatic cancer. My genetic testing was, unlike Libby's, my genetic testing was normal. They can't find any gene that's in my body that predisposes my family to pancreatic cancer. Will they find out in the future, in the next 5 years, before my kids get older? I certainly hope so. Will they find a test for the 16 kids test for pancreatic cancer, show up cancer that we can find this cancer, and that's my hope. And that's why it's so important for us all to be here, and this is why I've joined the National Pancreatic Cancer Foundation, to raise awareness and to raise money to support the great research we hear about today, the great surgical advances we're doing today, and hopefully in the future it will be something is potentially curable and preventable. And that's why we're all here, and that's why, again, thank you, the Pearl family, for arranging this day, and thank you for having me tell my story.